Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our Health Talk today is HIV awareness. Joining us today as our guest speaker is Dr. Rushdah Malik with the infectious disease specialist. She's going to highlight our viewers about what is HIV, what is AIDS, how do we recognize the signs and symptoms, and the prevention and as well as the treatment. Good morning, Rushdah, and welcome to my show.
Good morning. Good morning. I'm so happy to be here today.
Yeah, so just give a short introduction to our viewers and then we will start.
Okay. Yeah, I am an infectious disease physician and I work in a local community clinic with other groups of physicians. And I provide care for HIV, for infections, and also other chronic infection and illnesses.
So it's good to know because we see so many of these people, in our. I came across, I don't even remember how many, all these years of clinical practice in pediatrics, urgent care, emergency room. Sometimes it is very hard to recognize their symptoms, differential diagnosis and treatment. So I will start with first a simple question for our listeners, for our viewer. What is HIV?
Yeah, I think it's a good start. So
Yeah.
HIV is a human immunodeficiency virus.
Yeah.
And we know that it's there for a very long time. And it is sort of a virus that can live in the body for a very long period of time. It slowly attacks our good cells, which are our bodyguards. We call them CD4 cells or T cells.
Yeah.
And once these cells are infected, they are infected for life. And that's why it's so difficult to find a cure for HIV. But the good news is that we have new treatments that are making this disease very much likely under control.
Yeah.
And that's a very good outcome for our patients. And by doing this, by doing this attack on those good cells or T cells, what happens that slowly our body immunity get weaker and weaker, and then our body is open for all kinds of infection, and people go into infections and kind of wasting syndrome,
Yeah.
and they become very sick.
Yeah.
Very
In other words, these individuals, they get immunocompromised. Any single infection will overseed in their body because of the white cells, because of this because the virus attacks the T4.
Yeah, CD4 cells or T cells.
CD4.
You're exactly right. What happened is that as a normal, healthy human being, we are able to defend
Fight.
ourselves and fight those infections. But those patients, they are so immunocompromised, they cannot.
They
and
cannot
they
do
get
that.
infection one after another.
Okay. So looking at the symptoms of the HIV, with my clinical practice, I see some whom I can diagnose, right, looking at them.
Right.
But there are others, like, they will come with a weakness, lethargy, loss of weight. So could
Right.
you comment on their symptoms?
Right. So, that's very interesting because sometimes patients can be asymptomatic for a very long period of time.
Right.
And they don't know that they have HIV and they have just fatigue or, chronically they feel just sick a little bit. But then I can tell you that there are two categories we can put those patients in terms of symptoms. One is acute HIV syndrome, and we call it like a flu-like syndrome.
Right, that's what
there's some patients, more than 50% of the patients, what happens is that they can have this acute flu-like illness when they acquire HIV infection, and they're having fevers, they have sore throats, and they have enlarged lymph nodes, and then they develop skin rash as well. After some time, when body immunity try to fight back, these symptoms can go down, and it's amazing and surprising then that sometime for 8 to 10 years, these patients are asymptomatic
Yeah,
after this
amazing,
acute illness.
isn't it? Yeah.
But the one thing that I would try to emphasize on is that during this acute HIV infection, those patients are highly infectious. So if they don't know their status and they are engaged with other people, they can transmit HIV very quickly to other people. So that's why we would like to provide information and awareness to our community, to our people, to make sure that if anyone who is having
Those
any
symptoms.
suspicion or any symptoms, they should get HIV tested.
Right, yeah. And always better to get it checked ahead of time, not wait till the last minute when they become acutely ill.
Right, right. The other, the extreme of the symptoms, what I would like to tell is the AIDS syndrome. And this is acquired immunodeficiency syndrome, where we see that patients have progressive wasting, progressive illness. Their body is getting weaker and weaker, and then they develop very, lot of infections, and then they can develop even infections like Kaposi's sarcoma. They can develop cancer like Kaposi's sarcoma. They can develop infections like pneumocystis pneumonia. They have recurrent infections, respiratory infections, lung infections, pneumonias. They can have skin cancer like Kaposi's sarcoma, and even lymphoma. Those kind of cancers are they're very common in those patients with AIDS and progressive illness, and they really end up into wasting syndrome.
Yeah, but I do remember I came across a patient with a Kaposi sarcoma. But the most important thing I have noticed in my clinical practice, their throat. When you examine, they come for the sore throat, and we think about is mono or something. But when you look into the throat, I remember seeing that thin membranous the lesions, which could be suggestive.
Right, and that's a good point where a lot of these HIV patients can have oral thrush. Oral thrush is very common in HIV patient, and this is a white coating on the tongue. But people who have Kaposi's sarcoma and that involve the mucous membranes, they have dark purple thick plaques.
Okay, so they have the purple thick. Yeah. So where is it found?
Yes, so that's very that's very important to know that HIV virus can be found in bodily fluids that include blood, that include semen, that include vaginal fluids, and also breast milk. Okay. So that's why any patient, any person with HIV, any mother with HIV should not breastfeed their infants.
No breastfeeding for them. And so this can be like, now we want to find out the mode of contact.
Right. And again, that's where we want to provide awareness. So the transmission is something that if we can prevent the transmission, we can make sure that we are not seeing more and more new infections in the community. Of course, the transmission is through the sex, and it could be both oral and vaginal sex. Transmission could be through blood transfusion. We have standards that every time that any blood samples get donated, they've been tested for it. So we should have all those standards implemented and should not get blood transfusion from any, below standard sites. Also, as I said, that it can transmit from mother to infant during delivery, during pregnancy, during delivery, and also through the breast milk.
There should be.
The other important group is injection drug users.
So
I
was going to ask you
needles.
about that. Sharing needles. And
sharing needle is a big problem.
It's a close contact, right?
Right. Anyone who is anyone who is with multiple partners and they have unhealthy risks and unhealthy behaviors, those are at high risk of acquiring HIV. Yeah.
So the most important thing is the prevention, because once you prevention, the incidence, like you will show us the graph, how it has declined. So now can we talk about some of the treatment protocols before?
Yes.
You want to?
So what I want to show the slides and what I want to tell you is that it is, we have 1.2 million people with HIV living in U.S. And of those, every few years we have, we have new incidents of how many new cases we find.
Yes. This is a very good slide.
And
that
this
you
is
have got.
the graph from CDC. And what we
Yeah.
have seen in after decades, we see 8% fall
Eight.
in new HIV cases. This is
Okay.
the data from 2015 and 2019. Before that, we had cases declining, but that it was pretty steady, and we were not seeing a lot of decline. And I think this is first time we have seen that much decline, 8% fall in new cases, but
Yeah.
we still have around 35,000 new HIV cases in this new data release from CDC. And I think the good news is that we have new medications, we have very effective medication, and now we
Right.
have injectables that is
Yeah.
helping people,
I
especially
see that all
people
the
who are
time.
at high
They do
risk.
it on the television
Exactly.
about the new medicine injection. Yeah,
That
you
that is given as both treatment and
Okay.
also pre-exposure prophylaxis.
Oh,
we call
okay.
it
So
PrEP.
you can do that pre-exposure.
Right. So people with high risk can get pre-exposure prophylaxis, and that also now be available as injectable every 2 months, and that has decreased the new cases or new incidence of HIV. The other thing that I want to talk about is is on the next slide, where we have seen that who are those people with the new incidents or who are those new cases. And one thing concerning is that of those 34,800 people,
Yeah,
around
okay.
70% of the people are with HIV are LGBT community.
Right, yeah.
so
That's a big topic right there in itself.
It is. And I
Yeah.
think it is a lot to do with education. We need to go out, we need to come out and educate our communities, our special populations, our people who are living with, living in those communities, that they need to know that what are the risk involves, what we can do to prevent HIV. And this is the, one specific group of people that we have to educate and make sure that we do a lot of prevention for those people. 22% of those cases were among the people who were heterosexual, and then 7% of those new cases were among injection drug user. I'll tell you, it's a good news where we used to have injection drug user in a lot of trouble getting HIV. Now we have communities with programs where they do needle exchange programs.
Right,
They provide
yeah.
them new needles to make sure that people are not sharing needles, and I think that has helped.
That
a
is the most important thing, sharing the needles.
Right.
A source of contamination with the virus, injecting it into the others.
Right. And again, as I said, with the education and providing some community programs where they were given new needles, it helps that population not to acquire new HIV, have new HIV infection. So this is something that we all have to, it's an ongoing awareness. We all have to
Yes.
educate, especially the other thing, among those 70% people new HIV cases, we have more patients who are young adults. So we have more patients with new HIV, new disease, cases are between 25 and 45 years of age. And those are the people where, they are out and about, and those are the ones who are, at higher risk. So, the key education, what I would like to tell my viewers, that is to be, protective,
Awareness, protection.
to know what can put you in that risk. Especially our youth, we need to give them that message that they have to pick their choices very wisely. Any unhealthy behavior, any risky behavior can put them in situation where they can have lifelong consequences.
Right.
So, they should not be intimidated by social media. They should not let their guard down. Whenever they're around multiple partners, they should know how to protect themselves.
Social media also plays a significant role, doesn't it?
Yes,
Yeah, social
very-
media and this.
Very much so. Very
So
much
I
so.
just read, just saw it on the CNN or whatever, these drugs, long acting, if they are on antiviral therapy, for COVIDs and all that, does it suppress the immunity in these people?
Which one?
And people who are on antiretroviral therapy,
Yes.
does it suppress the HIV?
Yes. So
This was just came about, I believe it was 2 days ago.
Right.
I just noted it down.
So the key thing to know is that there's no cure for HIV. But
Right.
we know that the medication now we have available are very effective. If people start the medication promptly and they take it every day, they don't miss doses, they have such a good control of HIV virus that they can live normal life. People with HIV are living a longer life. Nowadays they have less complications and they have no infections, none of those opportunistic infections, and even lymphoma and cancer we talked about. People are free of those complications because of these medications. We call them combined antiretroviral therapy. There's no one pill or one drug that can help. What happens is because the virus attached to the good T cells and try to kill those cells, and they become a factory for producing millions and millions of that virus in the body. We want to try to kill that particular cell
cells.
or stop this, replication of the virus in the body by different sites. So there are combined medications that now available in one pill. They're very effective medications, and if people take one pill, now people are taking just simple as one pill a day, and they are very much suppressed. The virus load or viral suppression is so much go down that we don't detect it in the bloodstream anymore, and these people live healthy life. The one good news is, which is just FDA approved in last 1 to 2 years, is the injectable medicine. So now
I was going to ask you about this injectable one.
Yeah, so now we have this injectable medication that can be done once a month. So patients,
once a month, just get the. Is it like a IM or IV?
It is IM
okay.
medication,
Yeah.
but it cannot be done at home. Patients
It has to
they have to come to the clinic. They come once a month, they get their injection medication, and then they go and they can travel, they can do they can go around and and they can come back in a month. And now there are studies going on for every 2-month injectables as well. So these long-acting injectable medication is really the game changer.
Yeah.
And we're gonna see more and more people virally suppressed and living a better life.
So what I wanted to ask you now, is it okay to get for these individuals, people with this, to get the regular immunization? Will it hamper if they get the regular immunization series, like, pneumococcal vaccine or H flu and all that?
Right. That's a very good question. So every time these patients come to our clinic, we look for their immunization status. It's very important. They get all their pneumonia vaccines, they get their flu vaccines, and also hepatitis vaccines.
The 3 vaccines for our listeners to know is the pneumococcal, influenza, and
hepatitis.
Because hepatitis B, that is another big challenging issue with HIV.
And especially these patients with risk factors, they can be co-infected with hepatitis B as well.
Exactly.
So we check for their status first, and then we make sure that we give them vaccination for hepatitis A and B.
Hepatitis A. Especially people, who if they're going outside the United States,
they're traveling,
bad hygiene, poor hygiene and contaminated water and those kind. They should be taken care of by proper immunizations, right?
Right. Yeah, those vaccines are very important. And again, prevention is always better than cure. So when we do this preventive immunization, that make these people to live longer and more healthy life.
Yeah. Excellent presentation and excellent graph. How we have so far we are trying to control the whole issue.
Right.
The only problem is, some areas like in San Francisco area, people who are like homeless and and poor hygiene, poor housing, mental illness.
Right.
Most important thing is to control them, right?
Right. So, absolutely right. That's why I said that one of the target for us to provide awareness is those people who are at high
Right,
risk,
yeah.
homeless, injection drug users, and the other is our youth who are, if involved with multiple partners and using
Yeah,
drugs and, other, risky behaviors. Those two groups can be very easy
They-
target and they
right,
can
yeah.
acquire HIV very quickly. In fact, one of the last slide we have it on showed that according to statistics,
Yeah, that-
among 100 patients who have HIV, 87 people knew that they have HIV, but 13 people didn't know that they have HIV. And the problem is, if they are asymptomatic, they're not going to know, and they can give it to other people
Other
as well.
people.
There was one study I was looking at that it showed that before person know that they have HIV, they can spread to up to 8 to 10 people, and there are some studies that to up to 30 patients, so or 30 people they can spread. So think about that people who are living in those kind of situations,
Yeah.
or the youth if they are involved in any kind of
College
risky behavior.
campus.
Exactly.
It's very hard to, that's the area where
Yeah.
there should be
Right. So
be aware.
they should know what they're doing. They should know, and they
Yeah,
should be
yeah.
aware of what they are involved with, who they are involved with.
Yeah.
Especially our youth, our kids, the young adults who are in college campuses, who are out and
Yeah.
about. Even I say that once they are around a group of people, they should be aware of their surroundings and make
Yeah.
sure that they choose their behaviors very wisely. Yeah.
Now, is there any role of smoking or an alcohol in for the disease?
Yeah, I mean,
It's just a
I
general,
can,
right?
yeah, I get the
Alcohol,
clue there.
smoking, yeah.
The thing is that if anyone who's drinking and who's smoking and vaping
they are
as
more
well,
susceptible to everything.
yeah,
Right.
so that puts you in that kind of
Yeah.
mental state where there is a high risk of going towards the other behaviors.
Exactly.
With those,
Exactly,
people
yeah.
become uninhibited, and once they are in that kind of mind state, it is hard for them
Yeah.
to control themselves. So that lead to further consequences
yeah.
and going into further risky behavior.
Further,
Right.
yeah.
So these are the things that we have to really make sure that we, provide education to our population, risky population. The other thing that I talked about is pre-exposure prophylaxis. If
Yeah.
people living in those communities and people who, in any circumstances are more vulnerable, they feel like that they are at high risk, they can come and talk to their
Yeah.
providers about pre-exposure prophylaxis. And pre-exposure prophylaxis have shown more than 90% success in preventing HIV.
HIV.
And
yeah.
as I said, there's a medication available, one pill, one a day, and then there's injectable medicine that is available as well. And those have shown more than 90% prevention in acquiring HIV.
So for our public to know that this is preventable,
Right.
proper hygiene, good hygiene, and just avoid smoke, like you said, smoking, alcohol, everything precipitates
Exactly.
to their mental issue now.
Right.
Now we are talking more about the brain.
I know.
The mental social platform that has become such an important
Right,
topic
right,
these days.
Right. Especially for our young adults,
Yeah,
they are
yeah.
living in this social, platform whole day long.
Right,
And,
yeah.
they see things which sometimes intimidating, and people want to try new things, different things. And that lead to those kind of risky behaviors that can put them in that,
In that area, right? Yeah,
right.
yeah.
where they can get involved in those kind of
Yeah.
behaviors.
Like, before long time, a couple of 10, 15 years, we were talking about gonococcal infection, chlamydia, and those things. But now this thing has suppressed everything.
Exactly.
Yeah.
Exactly. And that's why there is a lot of
Yeah.
education about sexually transmitted diseases. And the
Yeah.
one thing, as you mentioned, anyone who has sexually transmitted diseases, they have higher chance of getting acquiring HIV as well.
Yeah.
More, more
Yeah.
than 50% as compared to anyone who does not have
Who
HIV,
does not have.
sexually
Yeah.
transmitted diseases. So that's another thing that make them more susceptible to acquire HIV. And as I said, there's no cure. We can, we can suppress the virus, but once person has HIV, they have HIV for life, and
Lifetime,
they have to live with it. So if everyone,
Prevention.
exactly, everyone,
Yeah, good hygiene prevention.
Right.
So that was good. That you gave such a nice presentation about this topic. What is HIV? Your last 1 minute. What would you for the audience and the viewers?
yeah. My message is for again
Message to them.
our LGBT community. My
Yeah.
message is for our youth. My message is for our young adults
Yeah.
who, are in those situations sometime where they have uninhibited behaviors happening. And in those cases, I want to tell them that we are with them. We have support. We have
Good
treatments.
support from
Right,
us.
from
Yeah.
community, from
Yeah.
physicians, from the healthcare clinics, from the community health departments. We have treatments that can prevent HIV,
Right.
and then we have treatment if anyone who has HIV, and the
Long
more
time
quickly-
survival with a healthy life is possible.
It is
for them.
possible,
Yes.
and if if they get into the care quickly, they're
They
gonna have a
can-
better
yeah.
life and healthy life.
So I'd like to thank you for coming to my TV show, Health Talk. I'd like to thank our viewers for watching me, my producer, and everything is available online with the Vimeos.com. All these tapes are submitted there. If anybody has any particular question, they can always leave a note for us at the TV station, and we will try to answer them.
Sure.
And I want everybody to have a wonderful, safe winter, and upcoming is spring, right?
Yeah,
Oh.
we're looking forward to it.
Okay.
Thank you so much
Thank
for
you.
having me.
And thank you again.